Hi, good morning, everyone. I'm Shalina Fotheringham, and I'll just take a few seconds for everybody to get seated and settled. Hi, good morning, everybody. I'm Shalina Fotheringham. I work at the National Council for Behavioral Health, and I'm really delighted and thankful for being invited to moderate this panel today. Before I hand it over to our panelists, I really wanted to spend a few moments just framing our discussion. A few months ago, the Atlantic Monthly published an article entitled, "How White Users Made Heroin a Public Health Problem," and the subtitle was, "In the past, when users of the drug were disproportionately Black, they faced severe punishment." And as many of you know, in the 1980s, the crack cocaine epidemic that plagued and devastated Black communities was dealt with by building more prisons, and the surge in the opioid addiction among whites has spurred a call for treatment and not incarceration. And our CEO, Linda Rosenberg, stated it very well: until we deal with our own bias personally and our bias of our institutions, disparities will persist. So throughout today's panel, we'll discuss how the Excellence in Mental Health Act provides huge opportunities, as was discussed earlier, to eliminate these disparities in access, treatment, and prevention. And we have a few slides that we want to just share with you today and provide some stats just to kind of frame our discussion. So throughout this panel, when we're talking about disparities, the working definition that we're using is from NIH and the Institute of Medicine. And the definition is any difference in prevalence or burden of disease or adverse conditions that exist among certain populations or specific populations in the United States. And we know these disparities often exist because of inequalities in access to treatment and how health professionals treat someone at a clinical encounter. And we have a next slide that kind of talks about mortality rates by race. And we know that although Black Americans only represent about 12% of the entire American population, more Black Americans die every year in this country than any other racial or ethnic group every year. And we understand that health disparities persist in our mental health system in both treatment and prevention. And so let me just share a few statistics. According to the CDC's High School Youth Risk Behavior Survey, in 2012, suicide attempts for Hispanic and Latino girls in grades 9 through 12 was 70% higher than for white girls in the same age group. In an article published by the American Journal of Public Health in 2014, death rates among Native Americans and Alaska Natives was 50% higher than for their white counterparts. And in 2009, in a health affairs journal that was published entitled "Racial Disparities in Involuntary Outpatient Commitment, Are They Real?" In New York, African Americans were more likely than whites to be involuntarily committed for psychiatric outpatient treatment. And this evidence just shows, as this slide, health disparities nationally, it's the slide before, evidence continues to show us that populations, specifically those of color in this country, have less access to mental health services, are less likely to receive the needed treatment, are more likely to receive poor quality of care, and more likely to delay or fail to seek treatment, and are more likely to terminate early. And the next slide shows that the National CDC Health Interview Survey is used to estimate the prevalence of serious psychological distress among American adults. And SPD is defined as any mental health problem that's severe enough to cause moderate to serious impairment in social, occupational, and school functioning and requires treatment. And in this first table, it shows that there's an inverse relationship between income and serious psychological distress. As many of you probably aren't surprised, the poorer you are in this country, the more likely you are to experience serious psychological distress. And when disaggregated by race and ethnicity, we see that Blacks were more likely, when compared to whites, to experience serious psychological distress. And when we look at alcohol use, so current, binge, and heavy alcohol use, we see that both Hispanic and Latino Americans, as well as American Indians and Alaska Natives, were more likely than whites to binge drink or drink heavily. Now let's turn to disparities in the criminal justice system. When we look at who was in jail in 2001, we find disproportionately higher rates of Blacks and Latinos in the system, as was mentioned earlier. And so as you see, in 2001, white Americans made up about 69% of the general population, and about 45% of that population was in jail, so less than the general population. But when you look at blacks and Hispanics, which made up 12% at that time equally, you saw 38% of the population of blacks in jail and 16% of Hispanic Americans in jail. And these disparities clearly still persist. So let's look at another infographic that was actually released in 2012 by Community Coalition, which started a huge national conversation around the pipeline to prison concept, which, as many of you know, is a disturbing national trend wherein children, particularly those who are Black and Latino, are funneled out of the public schools and foster care systems into criminal and juvenile justice systems. And this graphic really asks us to grapple with the question, are our children or certain children being pushed into prison? And I guess a few of the questions that I know I grappled with when I looked at this infographic is it by design that 40% of students expelled from U.S. schools each year are Black? Or that of students involved in in-school arrests or referred to law enforcement, 70% are Blacks or Latinos? Or that 70% of inmates in California State Prison are former foster care youth? Is that by design? And I think the next slide kind of shows there is an undeniable link between the health disparities that exist in the healthcare system and disparities that exist within criminal and juvenile justice systems. And this just shows that integration pretty well. So in 2009, adults in jail and prison had higher rates of hypertension, had higher rates of hepatitis, and you see rates 2 to 3 times higher in people that are in jail and prison than the general population. And adults in jail were nearly 7 times more likely to meet DSM-IV criteria for substance abuse and dependence who were incarcerated than those who were not. And also, the prevalence of serious mental illness, you'll see that adults in jail were more likely, 6 times more likely, to have a serious mental illness than those who were not in jail. So, in closing, our panelists will further discuss the great opportunities that the Excellence in Mental Health Act provide to eliminate many of these inequities that I named earlier, the inequities in access to care, the inequities in treatment and prevention, as well as jail diversion, through certified community health centers, through Medicaid access, and through care coordination. And now I'll hand it over to our first panelist, Dr. Gary Puckreen.